Hello, and welcome to our mini session on understanding how to engage the community, a very essential skill to learn as a community health worker. So what is engagement? If we were to define the word engagement, it's an arrangement to do something or go somewhere at a fixed time. When we apply that to our work as community health workers, we see that at the community level. Community health workers really can lead programs and participate in community collaboration. That could be information sharing, advocacy, listening, advisory boards, or community action networks. These collaborative groups can include not only providers, but other community-based organizations, community leaders, as well as program participants to strengthen those local services and address those social issues or social determinants of health. So what is the purpose of community engagement? There's several, obviously, that we can use to be able to develop the topics and issues that we are trying to bring to the community. We can help keep community members informed, whether it's about current programming, current events, updates to statuses, or even just keeping them informed about progress within a certain organization or task. Provides community level education. We can educate people on different topics or as new information comes out. It raises awareness, whether it's about a topic that has already been out there in the community and is known, or even about maybe topics that should become known. For example, when COVID came onto the scene, definitely the early stages of COVID, community engagement had to do with raising awareness. It, of course, provides a platform for community members to be heard, for us to really connect and be able to hear what issues could be of concern to them and what their needs are. And of course, it offers a space for families and parents to engage and learn from each other that maybe they wouldn't have had before, and be able to connect with each other. When we think of community engagement, there are several areas where we can really have that space to be able to participate and have those different strategies of community engagement. They can be in places such as town halls or health fairs, literacy and family reading events. Depending on the culture, community baby showers and first birthdays could be well-attended events, as well as health parties, family fun days, and of course, our community action networks who work together to be able to develop and work together within the community. So how do we do that? How do we really work within our scope of practice as community health workers to have a community action plan? Know that you are a valuable tool to be able to facilitate those conversations on the ground level and to really engage with people individually and in a personal way. It's also important to remember that we are not saviors or in the rescuing role. We really want to provide advocacy for underserved and at-risk populations. We want to ensure that there's collaboration and support to fully understand the needs of the community and not just assume that we know what the needs of the community are. It's essential to ensure that we are connecting and providing opportunities to listen with those whom we represent. Advocacy often involves getting individuals, organizations, or families to make big changes that might not be in their own short-term personal goal plan or even on their radar of awareness and urgency. So that might take a little bit of listening and feedback before we can actually develop some action steps. So in order for us to develop our own community action plan, there are several steps and areas that you really should consider. For example, we always start with our background and local information. It starts with research, especially about current facts and statistics. So some questions to ask yourself would be, is there any historical context on this issue? Is this an issue that is currently impacting your community? Who specifically is being impacted? And what has been the consequences? Really what you're trying to do is be able to fill in the gaps of your knowledge base. You can use different resources for this, such as online publications, there's local research or advocacy groups, media perhaps. However, you just have to make sure that your source is really a reliable and appropriate one. You also want to look at the general context of the issue. How do people feel in your community about this issue? Does this issue cause some division amongst the population? And what will it take to gain support or for people in the community to be accepting of the information that you're hoping to provide? Once you've kind of gotten that sort of background, then you want to be able to develop some sort of goal, right? We have to remember that we want a clear, broad goal for what your action plan is meant to address. Broad goals shouldn't be so broad that you cannot identify a clear path or an easy message. Much like when you develop your pitch, you need to know the general why you are engaging with the community. These could be things like changing public opinion, meeting an unmet need, preventing something from happening, or creating awareness. Often as CHWs, we're not the ones that are building the specific mission or identifying this big, broad goal. This is usually already decided by an organization with which you're employed. For example, UAMS has our general mission of a better health for all. This is a broad goal. Then we look at our community health and research, which has specific programs such as healthy food systems and family wellness. They take that broad goal and make it specific, such as providing education and individual care for fathers or mothers, for example. That is a highly more defined goal than the broad idea of health and allows for more tangible actions on how to improve health for individuals. So do that for yourself. Have that broad goal and what your mission is, and then clarify and focus your goals into specific objectives. And then remember that as a community health worker, your scope of practice is really to be within the community and think on that individual community level basis and being valuable in making those connections with families and individuals. From there, we can start to plan our strategies, methods, and tactics. Now, all of these words sound very similar, so we think of them as methods, which can be varied. We identify which one would kind of best suit our needs. And these methods could be methods we've mentioned before within outreach or within our own community engagement, such as those town halls and those fairs, those house parties, areas where we can know how we can connect with people. Then our tactics are those action steps. I call those finishing touches of activities to help you along the way. And of course, we think about strategies within our organization and the way that we organize and plan so we can guarantee success. From there, we kind of, and maybe even in your research steps, you might have been able to identify already allies and community partners. So these are people who share that common mission or interest in seeing that your goal is achieved. You can share information and resources, and honestly, the more help and support you can get, the more you can accomplish by working together. And of course, on the opposite side of that, we have our opposition. And I always like to remind people that opposition isn't necessarily like an adversary or someone that may attack your cause, although there are some issues that are more controversial than others. But more opposition are those challenges and barriers to engaging the groups that you wish to connect with. And by you recognizing what those might be, whether they might be the group that is organizing and kind of building strategies and tactics against what you're trying to work on, such as things like deflecting your issue, denying it, discounting, providing misinformation, creating division within the community. If you really know how to anticipate those tactics or what those barriers and challenges are, you're able to direct your resources and your actions to be able to eliminate these barriers from early on. In addition to all this, we also want to analyze and take inventory of what is needed for the methods we've kind of chosen and elected to do in our action steps. Different things we can analyze on these resources are things like funding, maybe not just monetary sense. We of course can do things like in-kind contributions, especially if we're working with different community organizations. A valuable resource is your staff and your volunteers. Most importantly, their time and their availability, and additional contexts you might have in the community that maybe aren't exactly aligned, but could be able to help you along the way. You have to think in practical senses of facilities, of where you're going to meet, and of course, how people will get there. Not to mention that a valuable resource is the information that you have on hand. And then lastly, we kind of want to look at evaluation of our efforts within the community. One thing to kind of remember is how will your outcomes be measured? And of course, organizations often have evaluation methods based on what you're going to work on in the community. But for yourself, you might want to kind of identify and know for yourself, how will the information obtained be used? And what metrics are you using to know if your plan is successful? Just like we are specific in our objectives, we need to be able to have ways to measure along the way and help us determine if these tactics and methods are effective towards meeting your goals, and be able to continue to use them, whether for this project and issue or for further engagement within the community. So thank you for your time, and I wish you luck in engaging with your community.